we had someone asking, at the sort of project level, have you had any issues with supervision? We've got someone here who says that they're working with a community garden and link worker, but there's a concern about vulnerable people. Who is responsible? So I wonder whether you could speak to that.
Thank you. Yes, it's definitely something that comes up very often, and it's a real consideration about the risks of when you're working with people. You have also, and I think the best way to do it is having the clear safeguarding policies set up between all the organisations who are involved in this case, the community garden, that then delineated who is ultimately responsible. And then that worker should know, if it might be their line manager or what person they need to raise that safeguarding concern with. But also having, because not everything is an absolute safeguarding concern, but it still might be troubling to work with. And I think that the workers need to have that regular supervision and time to debrief after the session, and training, how to cope with these difficult feelings of working with people that it might bring up in ourselves. And the Institute of Outdoor Learning have done a really good best practice document about this, which introduces this idea of, you're working within your remit, the referrals that you're receiving are appropriate. So the people who are needing, more intense mental health support or physical health support get that referral that they need, and they're not directed to a green prescribing intervention which doesn't actually meet their needs. So it's, that if you have appropriate referrals, good support for your workers on the ground so they know what to do if there is an issue, and then good support for their own mental health, so then they can continue to run the group in a empathetic way and put all the enthusiasm that it needs to support a group. So then it's a success for everybody.
Yeah, so thank you very much, that's really helpful. And I think just to outline that Jenny's put that resource from the Institute of Outdoor Learning on the Padlet, so that's there to refer to. Sam, would you want to add to that as well?
Yeah, I was just going to say, it's great to hear about how you can manage that from a practice perspective. And I know also a lot of the pilot sites are also wanting to set out kind of quality standards as well, so that green providers can work towards those quality standards. Part of their role is to kind of do that mapping, to kind of map people's capacity and their capability, and understand what level of need they're able to work with, or they might want to work with in the future, and putting in the kind of capacity building and training support that goes in behind that as well.
That sounds incredibly important. Thank you. Jane, I think you look like you had some more to add. Thank you.
Well, I was just going to add to what Sam said there, absolutely. So what we're doing in Heartlands is one of our working groups is focused entirely on training needs, and that's a large part of that is the training needs of some of our green sector organisations, and looking at how confident do they currently feel to support people with diverse needs. So we'll be looking certainly at that sort of training, but also looking at, as Jenny said, very clear safeguarding guidelines and some very clear protocols about how to escalate, when there are concerns about people. But we're also looking to introduce some sort of quality control, and we're looking at developing a sort of kite mark really for green social prescribing, a bit like the sort of red tractor, scheme, but this will be a sort of green social prescribing kite mark for those organisations that have gone through a sort of quality control process, so that people, whether it's a link worker or whether it's another healthcare professional, can refer people with confidence to that service, knowing that people are there and they are confident to support people with various needs.
Thank you all of you. That's a really comprehensive answer.